Knowing whether someone is, when I say asymptomatic, I think the assumption was they were asymptomatic for the entire time that they had COVID-19, that they had the virus in their body. They never had it. And they were so, in a sense, carriers. It was there, they were potentially transmitting it, but they never had any downside. They never had an infection as a result of it. And so I think for a lot of us, that's what asymptomatic meant. And so we distinguished asymptomatic from pre-symptomatic, which is, hey, I have COVID now, but I didn't have symptoms until Wednesday, which means, Monday, Tuesday, I was pre-symptomatic and contagious. This distinction between asymptomatic and pre-symptomatic isn't really that important for people in the world. I think what we really want to send home is that you can have no symptoms, feel well, and transmit this virus to other people. And it doesn't matter whether that person now goes on to develop symptoms later or never does or what have you. The issue is that you are infectious. And that's why I often talk, when I talk about masking, in just broad strokes, I just say, let's assume everyone's infected. Just assume everyone has COVID-19 and act that way. And that's part of the reason we're really pushing the masking, because masking protects us from the environment, from getting infected. But I can be asymptomatically infected right now. And by wearing a mask, I am protecting you. There's a lot still to learn about this virus and this infection, from its transmission to how it causes illness, and some of these really concerning persistent symptoms or recurrent symptoms that occur after resolution of symptoms. What we do now is act on what we do know, which is that most of these transmissions happen from what are called droplets, right? These are the things that mostly fall close to us, often require time, often ventilation, and often crowded conditions. So if we can avoid crowds, reduce time without masks especially, and be in places like this in the outdoors, the better off everyone will be.